A lot of women want to know how soon they can take a home pregnancy test and have it be accurate. Home pregnancy tests can detect pregnancy 2 weeks from the time of conception. So really the best thing you can do is wait until your period is supposed to start, and if that day comes where it never does, then it's time to take a home pregnancy test. If it's positive, congratulations. Be sure to pick and call an OB provider of your choice and make your first prenatal appointment. If it's negative and your period still hasn't started for another 5 to 7 days, retest, and any result you're seeing 5 to 6 weeks from your last period is pretty reliable. But if you have more questions about it, call your doctor and they'll determine if further testing is warranted. You mentioned that you have a 3-month-old little girl who recently switched formulas and then she broke out in a rash, and you're wondering if it's the formula. If that's the only change that you made in her life, like you didn't recently change detergents or soaps or shampoo or anything, there's definitely a chance that it could have been the formula. I recommend talking with your pediatrician, and after asking you more specific questions and taking their knowledge of your baby's history into account, they'll be able to decide what the most likely cause is of the reaction and what you should steer clear of. They can also talk with you about your concerns about a milk allergy and decide if that issue needs to be addressed. A true milk allergy will appear sometime during a baby's first year of life, and even breastfed babies can have reactions to it because if a mother is eating cow's milk protein products, then they will be passed through the breast milk and the baby can have a reaction. The most common signs of a reaction include stomach upset, rashes, vomiting, diarrhea, and it can even cause respiratory symptoms as well. So if your baby has difficulty breathing, if they have chronic nasal stuffiness, runny nose, coughing, those are all things you want to talk to your pediatrician about. They can help you sort out the issues and decide if it's due to a milk allergy or something else that might require medical attention and treatment. If your pediatrician decides that your breastfed baby does have a true milk allergy, they'll instruct you to follow a milk-free diet yourself, and that should solve the problem. If your baby has been eating formula, then they'll talk to you about formulas that don't have cow's milk protein in them that will be safe for your baby. A lot of women go to their doctor about concerns they've had in early pregnancy, and then their doctor orders an HCG level. So you go and get your blood drawn, and then you get a number back, and you're wondering, what does that mean? And really, your doctor is always going to be the best one to interpret your lab results. But generally speaking, there is some information about HCG that you might find helpful. HCG, or human chorionic gonadotropin, is a hormone that's released early in pregnancy, and levels rise exponentially until about 8 to 11 weeks gestation when levels peak. So if your doctor drew your blood on Monday, they'd probably want you to return on Wednesday and then compare those results. And really, more importantly than the number, the actual number, is the fact that it's growing. We usually like to see it about double in early pregnancy, so the doctor will compare the results, and if the pregnancy is going well, that's likely what they'd see. HCG levels alone cannot date your pregnancy, or in other words, if you're given an HCG result, you can't tell exactly how far along you are. Take 5 weeks gestation, for example. Your levels could be anywhere from 18 to 7,000 and still be normal. And so really, again, it's all about the trend. As long as the trend is going upward, then things are probably going well. You mentioned that you had some concerns about your 2-year-old little boy's teeth. You took him to the dentist, and they mentioned some sort of sedation in the future to clean off the tartar and check for any cavities or other problems that might need to be addressed. And you're wondering if that's a normal thing. If a child can go to the dentist and have their teeth cleaned without sedation, that's best, but some kids just totally freak out, and it's not even possible to look in their mouths without a little bit of sedation. So a lot of dentists will recommend some gas, and that doesn't put the child to sleep. It just kind of helps them feel okay with whatever is happening. It just makes them more relaxed with it. Every once in a while, deeper types of sedation are used in a dentist's office, but I do recommend talking with your dentist about their intentions and ask them the questions that you have. Generally speaking, there are a few things you want to consider if your child is going to receive sedation in a dentist's office. Number one, you want to make sure that the person who's administering it is well trained, they're certified, they know about pediatric appropriate dosage. There's going to be monitoring during and after the procedure. They've spent some time talking with you about your child's health history and that your child doesn't have any risk factors that might increase the chances of having complications during sedation. It's also a good idea for this person to check out your child's airway and make sure there aren't any obstructions like tonsils or something like that. And it's also good for enough personnel to be available in case an emergent situation arose. It wouldn't be a bad idea to ask the dentist about what their procedures and protocols are if something happens. Again, I recommend talking with your dentist about their recommendations, and based on their knowledge of your child's situation, they can give you the best advice. Menopause is the time in a woman's life when she stops having monthly periods, her ovaries have stopped releasing eggs that can be fertilized by sperm, so pregnancy isn't possible, and the ovaries have also stopped producing the hormones estrogen and progesterone. So this can cause a lot of different symptoms and side effects. Basically, if you notice that your bleeding patterns have changed, you're bleeding more or less than usual, your periods are shorter or longer than usual, if you're having night sweats, difficulty sleeping, depression, there's a host of different symptoms associated with menopause. If you've noticed these differences and you're between the ages of 45 and 55, they could very well be associated with menopause. The average age is about 51. So if you went to the doctor with concerns and you're in this age range, they would probably assume that you're going through menopause. But if you're younger than that, they might want to do further testing to decide if other medical conditions might be causing the symptoms you've been having. If you have concerns about menopause, I recommend talking with your doctor, and based on their knowledge of your circumstances and ability to ask you more specific questions, they'll be able to give you the best advice. You mentioned that you're 38 weeks along, you've had a little bit of cramping and lower back pain, you're wondering what this could be due to. And it's very possible that you're having mild contractions, because contractions can be felt as lower abdominal cramping, lower backache, abdominal tightening, pressure, and sometimes you have shooting pains down your thighs associated with all of those sensations. So basically, contractions are a lot of fun. They can range in intensity and frequency, and really what it takes is intense and frequent contractions in order for your cervix to dilate. And that's the true definition of labor, when your cervix is dilating from hour to hour. So because you're 38 weeks, you'll want to watch for contractions that are about 4 to 5 minutes apart and intense enough that you have to stop and breathe through them. And once they get to that point, then it's time to go to the hospital and see if you're dilating. There are other reasons why you'd want to go in sooner though. If you have any bright red vaginal bleeding, if you feel like your water's broken, or you're not feeling your baby move as much as usual, those too are reasons to go to the hospital, independent of whether or not you're contracting. For example, a lot of women think that if their water breaks, they need to stay at home and wait until contractions start. But actually, your water breaking in and of itself is an admit ticket. The things we're looking for are regular and intense contractions that are changing your cervix, your water is broken, or something's wrong with you or the baby. So it's always best to go with the first two. Go to the hospital if you have any questions about what's going on or you're concerned and feel like you need to get checked out. You mentioned that after finding out that you were pregnant, you went to the doctor and you had an ultrasound, but now you have some concerns. For one, you thought you were a lot further along than you are, and really, the best way to date a pregnancy or to determine your gestational age is to do an ultrasound in the first trimester, because a fetus will grow at a very consistent rate. So if they measure the size of the baby and other surrounding structures, and they said that you were 5.5 weeks along, then that's pretty reliable. That's the best way to determine your due date. Now, you also have some concerns about what they found your baby's heart rate to be at. It was around 88, and your baby's heart is just beginning to develop. And in the beginning, it beats a little more slowly than it will later. Studies have shown that at 6 weeks and 2 days, a baby's heart rate should be at least 100 beats per minute. And from 6 weeks, 3 days to 7 weeks, it should be at least 120. And then as the pregnancy progresses, the heart rate will get even faster. So you were still 5 weeks when it was 88. That can still be within normal range. So I do recommend talking with your doctor, though, and following up with the ultrasound that they want you to have next week. Based on those findings and their knowledge of your situation, they'll be able to give you the best advice about what's going on. Now, you also have some concerns about your progesterone levels, and I do recommend keeping your appointment with your doctor next week when they want to do a repeat ultrasound. Based on those findings and their knowledge of your situation, they'll be able to give you the best advice and information about your pregnancy. For now, watch for any signs of cramping and bleeding and call your doctor if you have those symptoms sooner than your appointment. If you'd like to see more tips like this and have questions ranging from preconception to pediatric health, be sure to like this video, like our Facebook page, and subscribe to our YouTube channel.